What drew me to medical oncology is, I'm sure, what a lot of people would say about their subspecialty. I just don't think there's anything like it. It's a chance to meet with people during a very vulnerable time of their life, including with their interacting with their patients and families, and trying to be there for patients during this time is like a unique privilege to malignant hematologists and medical oncologists. Also, the field is constantly growing. You have to be always on top of the latest research, the new standards of care. So it requires a lifelong learning approach, and that's also something that I was interested in. My approach to patient care is more of a team-centric approach. I think that's pretty standard, particularly in medical oncology. There are so many different providers that take part of a patient's care during this time, but at the center it's usually the medical oncologist or it's the patient, or both. And it really comes down to what's best for the patient and their family and how they want to dictate their care, and it takes a whole 360 approach from everyone in the building basically to get the optimal care for these patients. What I find most rewarding about my work is the doctor-patient relationship, getting to work with them, being there for them during this very trying time, getting to know them and their families over time, because these conditions are managed for a long time, and that allows you to get a better sense of the patient's trajectory and to hopefully lead to better outcomes for the patients. What I hope patients will say when they come to the office for their appointment is, I hope that they feel heard. I hope the patients and their families really understand what's going on, whether it's the diagnosis, prognosis, staging. I really want them to understand the treatment options and the way forward and any side effects that may come from there. But I really want them to leave with the confidence that they came to the right place, because it would be very atypical for someone not to be anxious, especially coming to their first appointment to see an oncologist. But I would want to put them at ease that they trusted us with their care.